someone suggested them कि ये करो तो cancer मर जाएगा, and they put him in a dark room. There's no light, and they didn't give him food. Diet is something which Indians are so obsessed about. How will the cancer fare is, okay, what should I eat is the first question.
Right.
So there are lots of myths associated with it and lots of misconceptions associated. Diet plays a role with obesity, with your inflammation in the body, and that leads to cancer over a period of time. So obesity is related to almost 13 types of cancer.
Where does protein fit into all this?
Protein are absolutely important. So they are the building blocks of the body. Many patients come and ask me कि sir sugar खाना मैंने पूरा ही बंद कर दिया. Well, it's not going to work that way, right? You have to change your system. You can eat sugar. From last 1.5 years, I have lost about 18 kgs of it, and I was 97. Now I'm 80. I'm taking about 140 odd grams of protein every day with a vegetarian diet. All the diet related advices will not work in an instant for you. It has to be slow, moderated. However, I would want you to meet a dietitian and take your proteins and everything in capacity that you can.
Food is part of our daily life, but when we talk about cancer, it suddenly becomes confusing. We hear claims like this food causes cancer or this food cures it, and most people don't know what to believe. The truth is, diet plays a major role in immunity, recovery, and long term health. But understanding what actually matters is the real challenge. So today, we are cutting through the noise with someone who truly understands this space, Dr. Udip Maheshwari, who has guided many patients on nutrition and cancer. I'm Keyur Vaze, and you are watching MOC Cancer Ki Baat. Let's simplify the relationship between food and cancer today. Dr. Udip, thank you so much for coming here and being with us today and discussing such a lovely topic, food, which is integral part of everyone's life.
Everyone's life. Absolutely. I think you've hit the nail on the head. So it's diet is something which Indians are so obsessed about. Right?
Correct.
So everyone in India, usually people tell that you need food to live. Here we live to eat, right?
Right.
So in India, the food and its perspectives are completely different.
Correct.
As opposed to have been abroad, the people don't talk about food so much. It's their normal A to Z, whatever they want to do every day, they do that.
Correct.
Not so many questions about food. But in India, how will the cancer fare is, okay, what should I eat is the first question.
Right.
So that is how important diet is, and that is why there are lots of myths associated with it and lots of misconceptions associated with it. So I think this topic is very important for us to understand that diet does play a role, but it's not the end of life for
Right.
for cancer patients.
Right.
And for all, not just cancer patients.
So I'd like to firstly start with a very basic question. Why do we need food and how does it play such an important role in our bodies?
So again, as I told you, we need food to live, right? So our normal functions of the body are because we need energy, and that energy comes from food that is usually either plant-based or animal-based, right? So plants make their own food, they store it in the form of fruits and roots, what we eat. And those are the energy-dense foods that we consume, and that gives us energy. And that energy ultimately is required for all our body functioning.
Right.
So man or humans are a very complex machinery system which requires energy to work, and those food items have different kind of nutrients like a carbohydrate, protein, fats, and all of those are required for certain functioning of the machinery that a human body is. So that is why I eat food, and that is required at regular intervals. Whenever we drain out of our energy, there's a food that we require. There is a food that we require for building muscle. There is a food that we require for oiling our system, or in for certain functions which are related to fats. So that is why we require food.
Right. And where does protein fit into all this?
So there's a lot of hype about protein
Yeah.
nowadays, right? So what protein? What is it?
Protein is the only food, by the way.
Only food, correct? Yeah. So there's a certain sect of community that tells that that the protein ke bina kuch nahi, protein is everything. And if you go to abhi household mothers and fathers, elderly people, unko, if you tell them I want to eat protein, so they'll say क्या खा रहे बेटा, ये कौन खाता है? So it's completely disparate opinions about protein, but I think we should be in the middle, a sweet spot that protein are absolutely important. So they are the building blocks. That is what people call the building blocks of the body. And they are not just that. So people just think that protein matlab muscle. It's not about muscle. It's not about बोलते हैं डब्बे वाली बॉडी, प्रोटीन खाएंगे तो किडनी खराब हो जाएगी, प्रोटीन खाएंगे तो ये हो जाएगा. So that's a misconception, right? So we'll have to understand why proteins are required for our body. It is one, that it builds muscle. Second, it builds immunity. So very strong for your immune markers, very strong for your metabolism, right? How you build your metabolism around it. So if you have less proteins, your metabolism is poor. Ultimately you get all cardiac, diabetes, everything is because your protein intake is less. And if your protein intake is less, obviously you need energy, you will eat something else, right?
Correct.
So you will eat carbs, you will eat fat, so you need that much calories in you. And if you don't take proteins, then you are taking something else, right? So definitely the energy comes from somewhere else, and that leads to an inflammatory state in the body, more risks of cardiac disease, more risk of diabetes. So not diverging from the topic, why proteins are important is because when we are eating our food during every day, protein, every gram of protein that we take is going into our muscle building, and it gives us energy in a very slow process, right? It does not give us instant energy, it gives us slow energy. And that helps our muscles to grow, become stronger, become, yeah. So beyond 40 years, if you see, the protein, there is body protein intake reduces in general for an Indian healthy individual. A protein diet reduces, they are more onto carbs. If that happens, then there is muscle loss that happens. So every year there is about 1 to 2% of muscle loss happening, strength loss happening from the muscle. And that becomes more and more as we go to 60 years, 70 years, and that is why they become frail.
Okay.
So how many 70-year-old would you have seen that they are walking, talking, running marathon? Out of the community, so many individuals who are 70, 80 years, they are not so fit, right? Because they're frail, their body, their muscles are weak, their bones are weak. And the more activity they do, there will be more fractures, there will be more fatigue, there will be more stress.
Yeah.
And that is because they have not maintained from 40 years, right? So they've not maintained protein intake, adequate protein intake from 40 years. So can you guess how much protein do you need in a day? I'll ask you one question.
Maybe I've read somewhere, so 1.5 grams per kg.
1.5 grams per kg, that's the protein intake that is required
For a bodybuilder.
for a bodybuilder, right?
Okay.
So for the WHO recommends that 0.8 to 0.1 milligram per kg is the protein requirement for a country like India, right?
Okay.
In US it is different. In US it is 1.8 gram. So it is a
Because there is
difference.
more meat consumption.
No, because it's a developed state.
Okay, developed state. Okay. Oh,
Developed
exactly.
country, right? So India is a developing country, and poverty, malnutrition was rampant, and that is why WHO rates it as minimum daily requirement.
Okay.
Which is a minimum daily requirement is 0.8 to 1. And for 0.8 to 1, for an average 60-year-old male, or a 70 kg, sorry, 60 or 70 kg male or female, it amounts to about 60 grams of protein.
Correct.
So don't mind me asking, what do you eat throughout the day? A vegetarian meal, if you have.
I'll eat some South Indian, let's say, like idli and sambar in the morning. Then for my lunch, one bhakri, one sabzi paired with some rice and dal.
Okay.
Then for, let's say, evening snack, I'll have some, let's say, upma or something like that with tea. And then at night, finish with dal chawal.
Again, dal chawal. So we're roughly having about 3 bowls of dal.
Yeah.
So one average bowl of dal will have about 3 to 4 grams of protein, right? So that amounts to 12 grams of protein. Correct. Rice, upma, millets, everything. If you have, say, you must not be having more than a kg of it.
Absolutely not.
800, 700, 800 grams.
500 to 800. Yeah,
800 grams of roughly all of that. That will have about 8 to 10 grams of protein. That. So 12 plus 10 is 22. And then you have other things that also accounts to about 10 to 15 more grams of protein.
Still, I'm
So
half.
you are eating only
Yeah,
30 to 40
grams.
grams of proteins in a day, at max 50 grams.
Correct.
Right? Even if you are eating, say, buttermilk, say dahi. So if that adds, then maximum is 50 grams in an average Indian meal that you described. Right? So 50 grams of protein is far less than a WHO requirement for a malnourished country.
Correct. Right, absolutely.
So most of the Indians, or most of the people in the country who are on pure veg diet, are missing the bus with respect to protein intake, and that is why you see India is the obesity capital of the world. It is the belly capital of the world.
True.
So most Indians who are doing well, 70% of them will have a belly beyond 40 years, which is very common in India. And why is that? One, you can say there is some play at genetics to it. There is genetics, definitely our bodies are like that. Second is our diet. So what we eat is very important. You won't see, if you go out abroad you won't see belly fat in most. So they may be fat, but they'll be fat across.
Correct. Yeah.
That may be that genetics may play a part, but then there are so many, 50-60% you will not see with belly. You'll see with flat because of their diet, obviously. For vegetarians also, we have a misconception that they can't eat protein because foreigners तो fish खाते हैं, chicken खाते हैं, वही खाते हैं और कुछ खाते ही नहीं है. But then in India, we have lots of things we can discuss about what proteins, how, and it's a very interesting topic.
That brings me to the next question. What is the difference between an unhealthy source of protein and healthy source of protein?
So there is you'll have to define proteins, categorize into two basic things. One is called plant source protein, one is animal source protein, right? So plant-based proteins and animal-based proteins are two widely available protein sources in India. Now you can give me an example of a plant-based protein and animal-based protein that you know.
Green peas is a plant-based, and animal would be chicken.
Correct. So green peas is not a very good source of protein.
Brown rice.
Brown rice is a good source of protein. So correct. The best one is soya.
Yeah.
Which you missed. Yeah. So plant-based protein, we have misconceptions about the quality of protein also, right? So the best protein that you can get with an animal source is chicken breast, right? For animal source, and which is non-vegetarian. So obviously that can be again divided into non-vegetarian, vegetarian, animal-based. So non-vegetarian, you will have chicken breast, salmon, fishes. And then there are meats, the muttons of the world and everything also will have protein, but they simultaneously have more fats as well.
Yeah.
Energy dense foods. So that will have more energy, everything, right? So then there is animal based vegetarian
egg.
So egg is also non-vegetarian or vegetarian, whatever you can call that. So egg is there, and then animal based, this is milk, dairy.
Oh yeah.
All dairy is high source of protein. So 1 liter of milk has 34 grams of protein.
Correct.
So 1 liter milk, you can condense it into a yogurt. So it will be a 200 grams yogurt, which will give you 35 grams of protein with a 200 kilocalorie energy.
Wow.
So that is the highest or the richest source of protein, right? And the most important. So that is one. And then you go to the plant-based major source is soya-based protein. So soy protein is the most richest. Then there's brown rice, and then there are others which are not so effective. 30-40% protein intake. Those are all legumes and lentils and dals of the world. So
yeah.
So all of those are another source of proteins.
Okay. So how does our diet influence our our immunity, then our long-term cancer exposure?
Correct. So when you have diet which is rich in carbs, which majorly it is, right? What we eat daily is, suppose I 5 years back used to eat 4 chapatis, rice, 1 bowl of dal, aloo, and that was my lunch with some onions or some cucumber. That was my lunch, a heavy lunch. Breakfast used to be 3 parathas with chai.
Oh, right? Nice.
And evening dinner used to be out, either a pav bhaji or something pani puri, indulgent. So it used to be a calorie dense, absolutely no proteins. And that, because I was young at that time, I did not notice the body did not change so much because, but then eventually I realized that, my belly fat is coming up. I am getting more lethargic. And, in that point, there was no. I then realized that over a period of time, I have not been eating proteins at
Properly.
all. Correct.
Yeah.
So that was all carbohydrates going in. Low fiber. There was no fiber. There was mostly carbohydrates. There was no protein, and that can lead to what? So that can lead to a state in the body which is called an inflammatory state. Means wherein the body, there is gut inflammation that happens, and that inflammation goes into the system. It affects the veins, arteries, everywhere. So that leads to a visceral fat deposition also. As in visceral fat, as in the fat that is around the organs, that is there inside, so around the stomach, around the this, so that can lead to belly obesity, and that inflammatory state ultimately leads to all the cardiovascular diseases, diabetes, and then eventually malignancy also, cancer also. So it's an indirect association to bad diet for a long time. So bad diet leads to obesity, obesity leads to inflammatory state, and it's a coexisting thing both together, and then that leads to multiple types of cancer. So obesity is related to almost 13 types of cancers.
Wow.
So that is where diet plays an important role. It's not just one thing that आज मैं sugar खाना बंद कर दूंगा तो मेरा cancer मर जाएगा. That is not how it works. It's a continuum of
It works in
events.
cohesive environment.
Yes. So you have to reduce you have to be mindful of what you eat. You can eat everything. ऐसा नहीं है कि मैं so many patients come and ask me कि sir sugar खाना मैंने पूरा ही बंद कर दिया. I mean, it's not going to work that way, right? You have to change your system. You can eat sugar. I have had cake today. I am perfectly on complete protein and high protein diet, but I've had cake today. So it's not that कि आज मैं cake खाऊंगा तो मेरे को बीमारी हो जाएगी. It's not that. Even cancer patients, you can eat somewhat somewhere in moderation. Nothing has to be that every day you're eating something, and that changes your metabolism altogether. So I've had so much of food for last 5 years that my metabolism completely changed. Then I became lethargic. I became my BMR became low. My energy density became energy intake became very high. So there was 1500 2000 odd calories plus every day that I was eating.
So into 365. So
into 365 days. So that eventually led to all the weight gain. I gained 18 19 kgs of weight over 3-4 years, and then that led to belly fat, lethargy. I used to feel tired every day, and then eventually, had I continued 40-45, I would have definitely had some cardiovascular event. So everyone needs to realize their point. And at that time, people used to tell me protein kha. I used to have the same reaction कि भाई क्या protein कर रहा है ना, खाने दे जीने दे. But then that's not something we realize, that when we see patients every day, we understand that their problems are such that if you are going down the same path, then how are you wise enough from seeing so many patients every day, right?
Yeah.
So then we realized that, and then changed my course of action. From last 1.5 year, I have lost about 18 kgs of weight.
Wow.
And I was 97, now I'm 80 kgs. So it's almost 17-18 kg of this journey has been fantastic. I'm taking about 140 odd grams of protein every day.
Wow.
With a vegetarian diet.
But what's the secret?
So
140 grams of protein with a vegetarian diet is a lot.
Yeah, it's a lot. So I try and take that. That helps. And I'll tell you, so I take yogurt. So it's a 450 milligram, half a kg of yogurt every day.
Wow.
That's about 65 grams of protein.
But just like that, or with?
Just have honey with honey.
Okay.
So just like that. It's boring. It's tasteless. But I do have. So when there was mangoes, I used to have mango yogurt.
Yeah.
But then that added 200-300 calories to my system. I could not lose weight with that. But then now, after mangoes are gone, I am having it without any fruit. So that keeps me active. But you'll have to do the boring every day, right?
Yeah.
So I've succumbed to the fact that 5 days a week I need my car. I need my vehicle to work. Means my body is a vehicle. I consider it कि ये मेरा गाड़ी है, Mercedes गाड़ी है. उसमें मैं पेट्रोल डालना है ना. पेट्रोल का टेस्ट नहीं होता है. So there is no
performance
taste.
होता है.
There is no taste to petrol. You put high performance petrol 5 days a week, then 6th and 7th day you can enjoy.
Right. But that's a good hack. I mean, adding yogurt, this amount of yogurt in your diet.
Morning is the yogurt diet. Absolutely. 60 grams of protein in a day in the morning, and I have a good protein smoothie that is about 30 grams of protein. I have some seeds mixed in the smoothie only, so that gives me antioxidants. And then I have in the evening I can have either, so anything from whatever I need, from pulses to dals to whatever I feel I can have. And in the afternoon evening snack kind of thing, whatever I have, some chole ka chaat or something, that gives me 15-20 grams of protein. And night I have either soya or paneer, and
Wow.
that is again 60 grams of protein night. So I do a hack with mix besan ka chila and mix soya in it.
Okay.
So it's a soya besan chila or a soya paneer chila. I have 7 or 8 of it, and that is 60-65 gram with dahi.
Again, the
So that gives me a good
enough
60
protein.
gram of
Yeah.
protein. So 60, 60 and 20 ka scoop, 140 is average. Afternoon sometimes I skip it. If I don't go to the gym, then I skip the smoothie. I just have food. So I can manage. So I manage between 120 160 grams of protein every day.
Wow, that's great. What are the most common myths associated with food and cancer? You just
So
said ki
I just
your
said I have one
sugar.
of it. Yeah. So sugar is the most. So most of the patients. So I've had a patient who came to us with a stage 4 cancer, had spread out disease everywhere. So what they I shocked me to the core when they told his story, what they did with him. So their family members put him in a room, and someone suggested them कि ये करो तो cancer मर जाएगा, and they put him in a dark room. There's no
My God.
light, and they didn't give him food.
Just no food at all.
No food at all. कि cancer को खाना नहीं मिलेगा तो cancer मर जाएगा.
My God.
And he had lost about 10-12 kgs of weight, came malnourished, with completely in a dark room. They must be giving him some liquid that the person suggested, probably. That was it. No sugar, no carbohydrates, nothing. And he lost so much of weight. They came to us for a second opinion, and probably we started. I don't remember how the disease panned out, but he responded well. That is what I remember. But then that was how the misconceptions are. So there are quacks sitting in the system who take advantage of hope and sell hope with respect to this. But I would want to tell all my audiences that diet is definitely related to cancer, but not in the way that we think, right? As I told you already, that diet plays a role with obesity, with your inflammation in the body, and that leads to cancer over a period of time. It's not something that you've done in the last 1 year. It's what you've done in the last 15 years.
It's not a panic here.
It's not, yeah. So it's something which is a slow changing event. So it may have more effects in the elderly patients, less effects in the younger ones, because they tend to have a good robust metabolism. When in your 20s 30s, patients don't get cancer because of diet, right? Because that metabolism is very robust. You don't get, so age related cancers are somewhat related to diet as well, because what they've had from the last 20-30 years makes a difference. So if you are having good diet, good everything, you may not get cancer. May not get cancer is also there, because if you're not obese, you're cutting off one of the risk factors. Even if you get cancer, suppose you are 60-year-old, right, and you're a well-built, good muscular body 60-year-old, and you get cancer, you can get cancer even if you are well built, healthy, everything, because there are certain other factors also which are related, right? So it's not just food. So if he has cancer, then possibility of him responding to treatment, him going through a lot of treatment, him taking the treatment very well, is very high, right? So I'd been to Europe, and I met oncologists there, so I'm discussing with them. So what are your challenges? So he was rather asking me, what are your challenges in India while treating cancer? So I said that most of the patients beyond first line, second line of cancer therapy, they become cachectic, malnourished, and we are unable to give. So you're saying, I'm surprised, because here post 4 or 5 lines of chemotherapy also, patients tell me that I want 1 month of break. I want to go and roam another country. They're that fit.
Oh.
That they want a break to roam around a country and come back. So patients there are not. See, you cannot take these comments as generalized for everyone. There may be certain patients there. There may be certain patients here who may have similarities, but in general, if you talk, there will be 70-80% patients who will be malnourished post this. So we're also running in a trial understanding these concepts at MOC, where we are measuring body parameters at baseline and how the as chemo goes. We have a dietitian on board, and that helps them keep their proteins and diet in place, and see how their body grows or body reduces, and see how what factors are affecting the nutritional status of the patients when on chemotherapy. So that is a study that is ongoing with us. We are will soon be in another 3 to 4 years. We'll be publishing those results as well,
Oh.
and that will tell us where to act. Right. So that will give us more clarity as to which thing to act on, whether it is an emotional decision, whether it is deep rooted in the mindset of people as to they'll not be able to eat, or whether with intervention can we change that. So that is all in process.
The pipeline, yeah. So I think when it comes to cancer in general, the patient and the family is already scared,
Absolutely.
and we function a lot from the space of fear. And
Absolutely.
when we are scared,
Mm.
and when people send you on WhatsApp, you should do this. When you see a lot of things on social media, this food, that food, avoid this. Start eating turmeric a lot. So there are so many myths. There is so many. You're overloaded with information.
Absolutely.
How to understand this misleading information and actual information?
Correct. So tell me, if you go to a cave and you don't know what is there inside, right? So
Yeah.
it's a dark cave.
Yeah.
Are you afraid of entering in?
Somewhat, yeah.
Yeah. So why are you afraid? If I tell you that there's nothing inside, I'll tell you with a background that there's nothing inside. If you just put in a torch, there are these structures which you'll see and come back.
Correct.
Then are you scared?
No.
Correct. So fear is of the unknown, right? So it's not fear is always of the unknown. So we should, if we don't know what diet is doing, what cancer diagnosis in general, if there is a cancer diagnosis, patients come to us and they are in fear, complete fear. So what my plan is for them is, to make them understand that this is the whole disease process. The disease may stay with you or may be cured, whatever the situation be. And these are the steps A, B, C, D. These are the steps that we need to follow. And diet also plays an important role in this. So most of them will ask me, what are the, what should we eat? Should we eat kiwi? Should we eat this? Should we eat that? They want all the exotic things that that they can think of. Everything. So मतलब वो kiwi से सब ठीक हो जाएगा ऐसा लगता है. So kiwi is the most notorious. Everyone wants to eat kiwi क्योंकि platelet कम हो जाते हैं. So everyone wants to eat dragon fruit, kiwi, and the most notorious food that people will ask me. And that is so I tell them that it's obviously food is very important, but it's not that you can see, if a person is eating sugar for entire his life, and every day Gujarati people, Marwadi people will have sweet in their dish, right? Even in the dals for that matter. So if you tell them, if someone tells them कि भाई sugar खाने नहीं है,
cut करने
पूरा बंद. So what happens is next day they feel lack of energy. They don't have energy. Their lethargy increases. Suddenly you can't stop sugar, right? So I tell them that whatever you want to do that in moderation. All the diet related advices will not work in an instant for you. It has to be slow, moderated. However, I would want you to meet a dietitian and take your proteins and everything in the capacity that you can, and whatever possible you try and take those things. So we have a proper diet plan that we give them, and at least they can follow 70-80% of it also. Then we are happy. Right. And I tell them that you try and eat so whatever they like. So give them an option of 4-5 things. So in fact मैं तो उनको स्मूदी भी बता देता हूँ कैसे बनाना है. आप ये बना के हो तो बोलते हैं, अरे वाह सर ये तो बहुत मस्त है, इसमें आइसक्रीम भी डाल सकते हैं. बोला हाँ डाल दो, कोई प्रॉब्लम नहीं. So as long as you're taking that 20 gram protein ka smoothie, I don't mind that 1 scoop of ice cream over it, right? So sugar is a myth. So they stop taking ice cream, and it's not just stopping that food will play mentally also on you. So already you are mentally disturbed with respect to the cancer diagnosis that you have, and on top of that unable to eat an ice cream that you see your relative having in front of you, and you're unable to enjoy that experience, and that plays a lot on you mentally, right? So that once that you're mentally disturbed, you are in a state where your body will not respond to whatever we do. See, scientifically I don't have any proof to tell you that these are the reference papers. You look at these reference papers, and it's a clinical experience. Patients who are not happy, patients who are cranky, patients who find faults with everything, they will be the ones who will have the negatives of it. So you've heard that theory of everything, right? So when whatever you think will happen to you, right?
Yeah.
So
Whatever can happen will happen.
will happen. So if you imagine, if you manifest, whatever things you manifest, whatever things you imagine, whatever things are running in your mind will eventually happen with you. So if you devoid them of that food, then their happiness goes away.
Yeah.
And then you are in that negative state of mind, and that plays a greater role in cancer treatment per se. So this is my view, can be controversial, but I feel that being positive is obviously very helpful, and diet can make that happen. And you should not be very very strict with your diet. It has to be more in moderation. Yes, I want you to take those proteins, I want you to take those calories, and I want you to build your immune system, but at the same time I want you to be mentally strong as well.
Right. But this kind of diet also helps during the side effects of chemotherapy radiation.
It does, to an extent it does, because you are if you are taking adequate calorie intake, your fatigue levels are less. You want to take those minerals as well. These minerals also play an important role in recovery. Zinc, for that matter, there are other minerals which help in recovery. So that also, those minerals are also very important. So recovery does happen if your diet is good. It is better than not doing. Only diet will not play a role. There will be other
Right.
factors as well.
So I think when it comes to patient and someone going through chemotherapy, radiation, surgery, his support system, his family is the one who is making food decisions for the patient.
Correct.
So what is that one core message that you'd like to address it to them so that they take better care of him or her?
So I think restriction of diet is important. There are certain chemotherapies where the WBC counts will go down, immunity will go down dramatically, and there we would advise to take neutropenic diet. That means that a diet which does not have raw food, raw vegetables, or anything raw. Right, everything is cooked, home cooked, and
fruits are okay.
Fruits are also raw. We avoid them. So during that time, so there are certain periods during the treatment where we will tell you that these diets you should not take, and you should listen to your doctors only. Don't take advice from the next neighbor who is telling you, अरे भाई मैंने हमारे टाइम पे इनको ये खाना मना किया था, आप भी मत खाओ. So that advice you don't take, because see, if you go to buy gold, you don't ask a cobbler कि मैं gold लूं कि नहीं लूं, है ना? So you'll have to believe and trust your onco physician and the dietitian that they have on board, if they have one, and that is what is important. Every decision that you take, you should not take it with your peer groups telling you 10 things and you try everything on your patient. That will reduce the morale of the patient, because the patient is already suffering mentally, which you or any family member cannot fathom, right? They cannot understand. I cannot understand, neither can anyone else understand this, right? So that we'll have to respect that and allow them certain things. There are certain stubborn patients who would want to eat everything outside. तंबाकू, माउथ कैंसर होने के बाद भी तंबाकू खाते हैं. Obviously there you will have to control, check. But yes, certain things should be allowed. Not be very strict with the diets. Certain patients, they may be stage 4, they may not have a lot of time to live. They may have 2-3 years only in future. So let them eat what they like, right? So that is also an important thing. So I mostly, if I tell any family that these are the cancer patients and now he's terminally ill and he may not have a lot of time, allow him to eat whatever he wants, he or she, whatever she wants. So all the diet decisions are based on the circumstance what the patient is in. It's not one for all, one fit for everyone, right? So we'll have to every stage of cancer we'll have to have managed diet. But the crux of the story is that your calorie intake and protein intake should be good for you to maintain a for you to have a healthy immune system to fight cancer as well. So, and plus to fight side effects of cancer, plus to sustain for a longer time. Your body needs to hold up. So your diet plays a very important role.
Thank you so much, Dr. Udip. It was a lovely, lovely chat with you. You spoke so much on protein, especially, and how it is linked to your immunity.
Correct.
How overall your diet plays such a big role in your journey, not just during the cancer, but also avoiding the journey of actually being on the cancer
Correct.
journey. Thank you so much for being here and enlightening every one of us, including me, with what should you eat and how should you, imagine food in your life.
Yeah,
Thank you so
absolutely,
much.
absolutely.